My name is Dr. Norbert Goldfield, and it's a pleasure to see everybody. What's wonderful about this work, which is, to be perfectly honest, the hardest work I've ever done. It's much harder than seeing patients, which I'll do all day tomorrow, and it's actually much harder than working with Israelis and Palestinians. Uh, and I've been doing this for 7 years. I'm the founder and executive director of Ask Nurses and Doctors. I'm just so honored to have everybody who's going to be speaking today. That's really one of the fun things about doing this work. You really sort of get to know people a little bit differently. Uh, though Justin Perkins has been to my house for a supper that I cooked for him a few weeks ago, so that's great. And today is a good example of the kind of sessions that we've continued to have over the last few months. We're going to take December off because we should just take it off December. And we have a focus on a congressional candidate. So honored to have Dr. Tina Shah. Then we're going to have one of the premier political strategists from a progressive point of view, Mike Lux, who's going to be speaking. And then, inconsistent with our continued focus on rural urban issues, definitely happy to welcome Justin Perkins, who's the one of the editors and publishers of Barn Raiser Media. And so the format will be that, for example, Dr. Shah, who will be speaking first, will speak for 5 to 10 minutes. Put your questions in the chat. I'm not going to mute people. If you want to mute yourself, I think that's great. Just if you, I see that most of you have muted yourselves already, and I think that's good. And just put your questions in the chat, and then we will, if we have time, those of you who know me, and some of you do know me, I always start pretty much on time, but certainly end on time out of respect for people's time. So, welcome everybody. Let's get started. Dr. Shah, thank you so much for joining, and she'll introduce herself. Everybody will introduce themselves in addition to the words that I've already said. And I just found out that Dr. Shah is one of Dr. Shah's mentor was a person who I wrote a book with many years ago, as I said to Dr. Shah, earlier than her birth, probably, on the issues of quality measurement. So, Dr. Shah, welcome, and thanks for being on this Ask Nurses Doctors webinar. Thank you.
Dr. Goldfield, it's a pleasure to be with you today, and nice to see everyone this evening. I'd like to say that I just age well because I'm always working, so I don't get sunlight. But it's okay. I'm taking the vitamin D tablets. My name is Dr. Tina Shah, and I am a pulmonary and critical care doctor who is running for Congress in New Jersey's 7th District. And I have to tell you, I am so thrilled to be here with you all because I think we all came to the table tonight because we want to make a change. We want to protect medicine and we want to protect science, and we must protect public health. And that is why we are all here. I want to share a little bit about myself. I actually grew up in New Jersey, and I am the proud child of Indian immigrants. And my parents, they really gave everything for me and my brother to have every opportunity. And like many on this call, I believe, I chose to become a physician because I wanted to tackle the toughest challenges and I really wanted to help people. But I think what we've seen is something quite different. And so, what I am doing now is I am running to stop Donald Trump from wreaking havoc on our country. I am running to make sure that we protect reproductive rights. And I'm running to make sure that we stop my member of Congress, Tom Kean Jr., and Donald Trump, who have cut Medicaid just to give tax breaks to billionaires. There is much work we can do, and it is just clear that we need new leadership and we need people that fully understand what is going on the ground when it comes to healthcare, now helping to shape policy in DC. And I'll tell you this, and I still practice, and I'm going to be a little punny. I hope you all don't mind. But as an ICU doctor, let me say this: America really is in critical condition. And I think this is our time where we have to say that we know things are getting worse and we now have to make a fundamental change. When I practice in the ICU, what I have seen time and time again is patients that have been failed by the US healthcare system. And I've also watched my colleagues, doctors, nurses, physical therapists, so many others, just broken by the healthcare system, burning out and leaving the workforce. And that is actually why I have spent the last little over a decade trying to work upstream, like many of you, to really, really figure out what we can do to transform how US healthcare works. I was actually privileged to work in the Obama administration, where I was VA's first chief wellness officer. And my most proud moment was actually tackling in basket message burden so that primary care doctors could spend more time on their veterans. And we actually increased access to care with 18,000 more vets being able to be seen a week. I then came back a second time in government, this time during the pandemic, and I got to work as senior advisor for the US Surgeon General. In this role, I drafted the nation's blueprint on how to address a great resignation and burnout across the entire medical workforce. And this is from the nurses and the doctors and the case managers all the way to our public safety officers that keep us safe so we can go into work, to the custodial services and so forth. And what was really interesting about that work is that we decided to label all of the specific stakeholders, from what should regulators do to what the tech industry should do to what legislators could do and so forth. And I have to tell you, when I came home and I started practicing again in New Jersey, and I actually work in my district in the Robert Wood Johnson Health System in Rahway, what I saw was tough. I have to share with you, and I want to give you a story because this happened 2 weeks ago, but I think it's pretty illustrative of what is happening now. I saw a woman who came into my ICU because she had a very severe asthma flare up or asthma exacerbation to the point that we had to put her on a ventilator. Unfortunately, or rather fortunately, we were able to get her healthy again. We were able to get her off the ventilator. And when she finally could speak, and this was about 10 days later, what she told me was that she had been completely fine, maintained on her inhalers for about 10 years. Then she had a new insurance plan. Then she had to go through pre-approval. Then it got denied. And she finally ran out because she couldn't afford to just buy her medicines out of pocket, to the point that she got so sick that we almost lost her and she had to be on a ventilator. I mean, this is 2025. Like, how are we dealing with this in the country of abundant resources, so to speak, in the country of innovation that is the leader in the globe? And I have to tell you, this story about prior authorizations, just honestly, I think everyone on this call probably has a story about themselves, someone they've taken care of, their loved one, that has had essential care denied, which is why when I came back to New Jersey, I actually worked with two of our state legislators and took a prior authorization reform bill that was dying on the vine, built a grassroots movement of patients, of nurses, and of doctors. And we passed that bill near unanimously to where it is law today. So now in New Jersey, insurance companies that have their plans regulated at the state level cannot deny essential care. But this is the kind of work we have to do at the federal level. And I'm going to get in the weeds because I think we're all kindred spirits. We will actually see in 2026, and Jersey is one of the test sites, 6 states that will now be introducing this harmful practice of requiring prior authorization or pre-approval of services in traditional Medicare, something that has never happened. So while we know this is a harmful insurance practice that is about saving money at the expense of good medical care or even life, we are now expanding this into yet another sector, traditional Medicare. This is not okay. And this is exactly why I'm running. Now, I want to tell you about my member of Congress, Tom Kean Jr. This is a man who is a career politician. What he has done is vote to cut Medicaid. He actually cast one of the deciding votes so that billionaires could get tax credits. He voted to defund Planned Parenthood. He voted to make it harder for rural hospitals to survive. He voted to make it harder for children to get health care. And also, all the while saying that he was going to make healthcare more affordable. But in my state, what we know is that premiums are going up 174% on the marketplace. So I don't know what it's going to be like on January 1st. What I do know, though, is that in the hospital, we're going to see people who will wait longer, and then they come in, and then they will be sicker than ever before. This is also a man who has given RFK cover so that RFK can replace scientific and medical experts off of the vaccine board, who is threatening to, do the same thing that to the U.S. Preventative Task Force that he did to ACIP, who has cut funding for CDC and for NIH. I know I'm preaching to the choir. I'm getting worked up here, but I think what is clear is that we have to have doctors in Congress. We have to have people that believe in science, because RFK is not being held accountable, and that is exactly what I intend to do. So I am ready to stand up for my patients and my neighbors and my community in New Jersey and all of the people that believe in evidence and science across the country, because we can flip my seat. I am in one of the most competitive districts. It takes 3 seats to flip the House from GOP control to Democratic control. And that is how we will do the good work for healthcare and science together. And I am just so privileged to be here with you all. And I cannot wait to do this work with you. Thank you.
Thank you so much. Thank you so much. Uh, Feel free to put a couple questions in the chat. Happy to have Dr. Shah respond. Look at the chat in a minute. I have a question for you, because as I indicated, that I have to have fun doing this work. I understand that you've done a fair amount of work with AI. So I'd like to hear some funny story, one funny story that you got a response from AI that you think would give a smile tonight.
Oh my gosh, I love this question, Norbert. And, I also want to let everyone know I was privileged to actually work as chief medical officer of an ambient AI company called Abridge, which is using AI to summarize clinic visits and even inpatient visits for doctors and also now for nurses, so that we don't have to keep typing on the computer while we're with our patients, basically doing our documentation. And I'll tell you, I used ChatGPT when earlier on, Norbert. And I started off with like, okay, draft me a letter for this and a letter for that. And then I thought, let me take it a little spicy. Draft me a breakup letter. Let's say I wanted, I was back in a relationship, I really needed to break up with someone. I might have been channeling Sex in the City. Someone broke up with someone on a post-it note. I thought, hey, maybe ChatGPT could do better. And I got to tell you, Norbert, it was a flawless and very genuine breakup letter. So, should I ever need to use it, I know how to get
Thank you. I've been married for let's see now, since 1979, so that's quite a few years. And I kind of like my wife. I think I'll leave it at that.
Maybe you could ask for a love poem.
There you go. Um, the next two speakers, starting with Mike Lux, one of the things that people say all the time, and this is the balance that we have to have, is that in a webinar such as this, is that we're kind of preaching to the choir. Both Mike Lux and Justin Perkins can speak to the issue of, well, how do we reach across to the other parts of the choir? And what are some of the tough issues that we have to focus on? So I don't think there are any immediate questions. Oh, hold on a second. I don't see.
Looks like there's one.
Yeah.
Let me see if I
How crowded is your primary field, and what are the biggest challenges you will face in the run?
Yeah, this is a great question, Belinda. Thank you for asking, and nice to see you. I will tell you that I am running in a crowded primary. There are actually 9 candidates. And what that indicates is how vulnerable the sitting member of Congress is. This is a district that actually has now been labeled a toss up and actually went blue in our governor's race. The entire district went blue, which was a shift earlier this month. So I will be honest with you. Yes, it is a crowded primary, but I have now raised the most money of any of my primary competitors in the last quarter. And all of the local and national groups are now looking to see if I can continue this momentum. So I, am really, really delighted to be standing up. I am the only physician. I'm still practicing. I'm going to be doing Thanksgiving holiday stretch, and I think that's a badge of honor. And I'm actually looking to raise another 4,000 before we get into the holidays. And so I'm just going to make my shameless plug here. I hope you don't mind, Norbert.
Not
But
at all.
if
I'm
everyone on
going to
this,
make a donation myself, so go for
oh,
it.
wonderful. I'm so thankful for that. If everyone would consider chipping in at least 100, that's going to help me get very close to my goal. And this is what it takes to put a medical expert back in the house.
Just real briefly, this is a complicated question from Dr. Geston. Bill Cassidy is also a pulmonologist, critical care physician. I believed he played a major role in letting RFK Jr. happen. What forces do you think influenced him, and how do you see your ability to resist those same influences? And then we're going to stop and go to Mike Lux. And actually, Mike might have a comment on that also. So I just want to highlight that. But go ahead, Dr. Shah.
Yes, and actually, I believe not that it matters because doctor is a doctor. I believe Bill Cassidy is a gastroenterologist with a specialization in hepatology.
That is correct. He's the one that he also really pushed the hepatitis B vaccine because of that, blah, blah, blah. But that the question still remains is
Yeah, you know what's happened in Congress, including the doctors that are currently serving. They are dysfunctional. They are not stepping up. They are scared, and they are not protecting their own districts and their own people. And I think it was a mistake for Bill Cassidy to believe RFK would, after I'm trying to think years of spreading vaccine misinformation prior to his appointment at HHS, thinking that he would do anything different. I do believe that Bill Cassidy, regrets his decision, but it's too little too late. He's getting primaried as well. And I think this is a testament to we need people that are not career politicians, including physicians, and we need more physicians in Congress. Now, what I'm going to tell you is my only skin in the game is the fact that, full disclosure, sometimes I come home from the hospital and I find myself saying to myself, I can't take it anymore. I am just so upset at knowing how to take care of someone, but not having the tools to do it and not being able to fight corporate greed. And that is what's going to protect me. And to be honest, a lot of my physician colleagues have my phone number and they're going to call me if I, for some reason, start going a different direction. But I just can't see how, when you're practicing on the front lines, you can bend over like this and just put the American public at harm like this.
thank you again, Dr. Shah. Mike, it's all yours. And thanks so much for being on, Mike. And I appreciate looking forward to hearing your thoughts.
Thank you so much, and it's great to be with such a wonderful and interesting group like this. I work right across the hall from a group called 314 Action, which supports scientists and doctors getting into races, and I have a feeling they'll probably support Tina. I think she's one of the best one of the best advertisements for why it's important to have scientists and doctors in Congress. So I appreciated hearing her remarks. I want to focus on the healthcare issue, not just because you all are healthcare professionals, but because I have been writing about this for a long time on my Substack column. I believe healthcare is going to be the critical issue in the 2026 elections, above and beyond, far beyond any other single issue. I think that we are at a moment of crisis in American healthcare, and that is becoming more and more real to people, more and more personal to people. I've done a lot of work over the last few years because it is such a swing state in Pennsylvania politics and in important counties in Pennsylvania, not rural counties, not tiny counties off in the middle of the state, but in suburbs of Philadelphia, and hospitals are closing. Two major hospitals in Delaware County have announced they're closing, and so people in that county are going to have to drive to Wilmington or down to Philly to get to an emergency room. And that is insane. I mean, to think about something like that is so scary. One of the other reasons I think that this is going to be a big issue for my party, for the Democratic Party, is that I think, and I wrote a piece on that. And Norbert, can I swear on this call?
It's we're not sending this to, it'll be on the web,
I
so you,
I don't mind that.
but I've heard you, even today swear, on the other call. And
I've been known to do it before.
yes,
Um, I just wrote a piece today. It's not published yet. It'll go up tomorrow. Talking about the clusterfuck that Republican healthcare policy is. The problem for the Republicans is that they want to cut benefits. They want to cut coverage. They want to move the healthcare sector to the free market, so to speak. But the free market does not work for healthcare. It's not like other commodities. It's not something that the free market is very good at. And so when you say, okay, Donald Trump has been saying for 10 years now that he's going to come up with a healthcare plan. The reason that he never has is because whatever he would come up with that would achieve his goals would be incredibly unpopular. And the interesting thing, I suspect Tina knows this very, very well now. The interesting thing about voters is they know the details about healthcare policy. They understand healthcare much more than most policies. When you talk about tax and budget stuff, when you talk about trade, when you talk about all kinds of other issues, folks don't necessarily know a lot of the details. But when you get into their healthcare, how it's going to affect what coverage they get, how it's going to affect how much it costs, people really notice, people really care. And sometimes that hurts reformers. When I was in the Clinton White House working with Hillary on healthcare, that hurt us because people were scared about what might happen, and they were weighing all the costs and benefits for themselves, and the insurance industry was able to make some effective attacks based on that. But we're now in a situation where the Republicans can't say what they're for on healthcare. So they can put out a policy that they know will be unpopular. Plan B is to say nothing, which is what Trump has been doing for 10 years. I'm coming up with a plan later, next week, next 2 weeks from now, and so they can say and do nothing, which is not going to work right now because people are so mad about their health care, and they're mad about subsidies ending. They're mad about costs skyrocketing. Or they can join the Democrats in voting to keep the subsidies going. Of course, if they do that, they piss off all the big healthcare industry donors. So they are in a world of hurt on this issue, and hospitals are starting to close, even though the Medicaid cuts are not coming in until after the election. Hospitals are already looking at the bottom line a year from now, 2 years from now, 3 years from now. They're saying, you know what, we're not going to make it. So we're going to see hospitals close all over this country. We're going to see emergency rooms shut down. We're going to see all kinds of problems in healthcare. Meanwhile, the costs for Americans are going to go up. So I believe that this is going to be the issue in the next election. It's why I think candidates like Tina are going to be so strong, because she knows what she's talking about on healthcare. And I think that will mean very good things for the Democrats. One comment that I want to make, though, one caveat to that, and I know Norbert, your group has been in the middle of this, is Democrats need to have strong healthcare policies of our own. It's not enough just to say, let's keep subsidies going. It's not enough to say we're against what the Republicans are doing. We have to show people that we know uh, the healthcare issue, that we understand the healthcare issue, and that we have specific ideas for making it better. And again, that's a great thing about a candidate like Tina. She knows her shit. She knows her stuff, and she's going to be able to speak to that. And I think we need to demand that us Democrats need to demand that of Democratic candidates that they know enough that they can talk with confidence on healthcare issues, and that they have specific policies that they are in favor of. I think that's incredibly important, because we can't just run against Trump. We can't just run against the Republicans. We've got to be able to say what our policies are, what we're in favor of, and most important of all, who we're fighting for. I'll stop there.
So let me ask you a couple of questions, and then Ed Shore had a comment. The In terms of reaching out as health professionals, to reaching out to undecided or voters who don't trust Democrats, what can we as health professionals bring to bear? How can we convince these undecided? I'm not talking about Trumpites here, because we don't need a huge sliver, but we do need a sliver. So what role do we have, and from your experience, how should we be playing our cards as health professionals to try to convince some of these undecided people to switch their vote for 2026?
Well, so if my theory is right that healthcare is the most important issue in this election, healthcare professionals have credibility. I mean, when I've been doing polling on healthcare issues for about 35 years now. And this has been true from my days in the Clinton White House until today. The people who are most trusted on healthcare are healthcare professionals, are nurses, are pharmacists, doctors. They trust healthcare providers more than anybody else, and they really believe in you all. And so I think it's important for healthcare professionals to be out there, making speeches to local groups, be out there writing local op-eds, letters to the editor. If you've got Substack, or if you're doing social media, to be writing things about what's going on in the healthcare system, why Republican policies are hurting people, and why Democratic policies are important to get in there, because you all are the ones who have more credibility than anybody else.
Ed Short comments, renewing subsidies is not sufficient. Your comment on that?
Completely agree. I think it is. We need to stop the worst of what the Republicans have done. And that means we need to bring back the subsidies that are there. We need to bring back the Medicaid coverage that was there. But I think we need to, as Dr. Shah says, I think we need to get into the weeds here. I think we need to talk about what are the specific ways that hospitals can cut costs. What are the specific ways what are the regulations on the insurance industry that are going to most help providers do their jobs without as much interference from the insurance industry? What are the ways that we can bring down prescription drug costs? How many drugs can we be reducing the cost on? I think we need to be specific with folks. I think voters, based on my research, voters are looking for specifics, especially on healthcare, because they follow their healthcare more than they follow any other thing. They're scared as hell about losing their healthcare, or about the costs going up, or about what they might have to pay if they have an emergency room visit. They're really scared about it, and so I think the more specific Democratic candidates can be, the better.
Okay. Just one last question, and then we're going to turn to Justin. Um, Dr. Hoy, who's a nephrologist, asked the question, can the disruption by HR1 be used to re-engineer our priorities away from expensive ICUs, end-of-life care, to emphasizing the availability of primary care?
Do you want me to answer that or Dr. Shah?
I'll let you take a crack at it, and just from a purely hardball political point of view, and then we'll move on to Justin.
I, I,
Want to
I,
add anything, obviously, Dr. Shah, to that, to whatever Mike says, go for it.
I think the answer is yes, that we can use this moment to push for more primary care and for primary care physicians to get more help from our government in terms of the policies that are fostered. This was something that was a very big deal when we were working on this in the Clinton White House. It was a very big deal when we were working to pass the ACA. But there is a natural market incentive, as you all know, to push for more and more specialization. And I think that the government has a responsibility to do everything they can to foster more primary care. Dr. Shah, I'd love to know what your thoughts on that are.
Well, I share Dr. Hoy's background in that I'm a specialist and I'm very pro primary care because I mostly see, I feel like at least close to a third, if not a half of the patients that I take care of shouldn't have come to me. We could have intervened much earlier instead of coming to the ICU.
Hmm.
So we know that we have a finite amount of money. We already spend 21% of our GDP on healthcare. Why don't we put the dollars in the place where it gives us most bang for our buck? And I think this is really talking about shifting to outcomes and value and what patients think are value versus saying, hey, we did a service, let's pay for it. So I think maybe this is our next chapter of really trying to push to value-based care, and that relies on primary care being the leader.
Well, I did that for 35 years, and unfortunately, we're still focused on specialists in terms of connecting payment with better outcomes quality. But I'll never give up. So thank you to you, Dr. Shah, in case we have to leave. Uh, and um, And thanks, Mike. I'm sure there'll be a couple questions more that all of you who are still available could answer. But in the meantime, a lot of the issues that have been brought up come from are relevant with respect to rural areas in particular. And Justin Perkins, who's works with Barn Raiser Media. And I should point out that I'm a supporter of Barn Raiser Media. So it's not just that I'm going to make a donation to Dr. Shah's campaign, but I'm an ongoing supporter of Barn Raiser Media. So I would definitely encourage you to look them up and be interested. So Justin, thank you so much for being on tonight and looking forward to hearing from you. And we'll then ask some questions.
Yeah, thanks, Norbert. It's a real honor to be on this and speak with you, Dr. Shah and Mike as well. Um, and like Norbert said, I'm an editor at Barn Raiser, and I'm originally from Nebraska. Was born in Nebraska, which I think, Mike, we might have that in common, perhaps.
We do have that in common. I'm born and raised in Nebraska, in Lincoln. Where are you? Were you born and raised?
Just outside Omaha, in Papillion, but I went to school in
Oh,
Lincoln, so I know it well.
that's great.
Yeah, that's good. Well, so yeah, I want to talk tonight here just from the rural perspective point of view and highlight a few things that we've looked at in our reporting through Barn Raiser. Of course, um, the 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 sort of huge issue that we've been covering ever since it was passed in July was the big reconciliation bill that Trump and the Republicans passed, which dealt a huge blow to not only things like Medicare, Medicaid, and SNAP, but represents one of the largest transfers of wealth in our nation's history. And I think it's really important to sort of keep that in mind front and center. And I think just a few sort of statistics that we have that from a rural perspective. 1 in 4 people in rural America use Medicaid, um, and the this reconciliation bill passed over the summer will is estimated to reduce spending in Medicaid by 1 trillion over the next decade. Um, and in rural areas specifically, that will result in an estimated $137 billion lost in rural areas. And I think it's important to understand the whole holistic impact of what that loss is in rural America. And because it's not just hospitals that are losing out on this money, but it's jobs that are on the line, it's local economies as well. And as of a few months ago, almost 1/5 of rural hospitals that still exist were at risk of closure or severely reducing services. And to sort of compensate for these massive cuts, of course, there was passed a $50 billion, what's been called a rural transformation health program, which I think the Republican Party is shrewd enough to know that people will understand the impact that these cuts have to rural areas, very specifically into hospitals. So in order to get the bill passed, they sort of threw in this $50 billion fund. And we saw this come to a head again in the recent government shutdown that from the Republican Party, they were making claims that Democrats, by not voting to reopen the government, were effectively looking to gut rural health care, which is simply not the case. If you look at the plain numbers themselves, first of all, that $50 billion added to rural health care is nowhere near close to covering the 137 billion that will be lost in rural America thanks to the summer reconciliation bill. And secondly, I think it needs to be pointed out very specifically that what is being added to rural areas in this $50 billion fund is essentially what could be called a slush fund. So it only covers 5 years, which is a far cry from the ongoing funding through Medicaid. And half of it, $25 million, is set to be distributed evenly to states, which states are now applying for funding for that specific funding. But the caveat here is that there's specific requirements that will determine states' eligibility. And as we've seen from previous executive orders, lots of federal funding has been made conditional based upon how a state or a given entity relates to specific priorities that are in this administration's agenda. But then finally, the last $25 billion is will essentially be distributed by Mehmet Oz based upon certain criteria of what qualifies as rural, and I'll just sort of leave that at there for now. So I think one other thing we've looked at in our reporting as well is looking at the interconnectedness of rural veterans healthcare with the wider healthcare system. I think it's important to not treat those as two different things, but see how they're very much interrelated. And I think it's another area where there's lots of vulnerabilities for GOP candidates that perhaps not many Democrats have capitalized on as quite of yet. One of those things is that there's been significant efforts to privatize veterans healthcare. One way this has been done is through the VA Mission Act, which, in a sense, allows for veterans to supplement their VA care by seeking it out in private contexts. But the justification behind this, especially, is targeted toward rural people by saying that they may not have close access to a VA hospital or such, and so purportedly giving veterans the option to seek VA care in a private setting will expand access. But as it turns out, this is sort of a back way to defund veterans care. And if you're in a rural area, that narrative doesn't compensate for the fact that already rural communities are facing such lack of access to hospitals that are closing, and even critical access hospitals that are closing. That there's not much choice available, and most veterans would actually choose to go to the VA. And I think, and another thing with another statistics I want to highlight with rural hospitals too is, as many of you probably know, I'm sure that obstetrics is one of the more expensive parts of running a hospital, and so it often becomes one of the things that is first to close as a hospital is seeking to reduce spending, cut funds. And today, more than half of rural counties now have no hospital-based obstetric services. So I think there's another interesting narrative there that can be pushed, that while people on the Republican side might claim to be sort of pro-life or pro-family, I think it's important to really hammer on the point that women absolutely need to have control and the right and agency to decide their own healthcare decisions, and that even includes decisions about how they can give birth, and that so many of these policies are sort of death-dealing policies by essentially taking away these essential services of giving birth. That I think it's important to whether you're a candidate or whether you're sort of talking about these issues in public settings, sort of bring these things down to home, to specifically to the community. For instance, one thing we've heard that has really resonated is that if you're in a rural area, you sort of take pride in your community and the institutions, and that people are very proud to say that they were born in their town, or they were born in their county, and that for so many people now, that's no longer possible to say with the closing of these obstetric services, that people are no longer able to be born in their hometown or their local area. And finally, one other sort of very specific legislative piece I'll raise up is reform of pharmacy benefit managers, which is actually legislation that has been introduced in Congress on by both Republicans and Democrats. And I think it's important in rural areas too, rural people understand the need to have that you need to advocate for fair access, that the playing field needs to be fair. And what we have nowadays is something that's very far beyond that, with the consolidation, the pharmaceutical industry, where you have basically sort of three big players in the pharmacy industry, with CVS Health, Cigna Corp, and United Health, who control a huge portion of the market share. And a national poll actually recently found that 84% of likely voters say it's important or very important to have rules that require pharmacy benefit managers to provide value and lower drug costs for consumers. So that's another angle on this, sort of, as this notion of kind of affordability is coming to the forefront, as well, that there's sort of specific pieces like reforming pharmacy benefit managers that can be targeted and really hit home about uh, ways we can sort of make drugs more affordable to everyday people.
Thank you.
I'll leave it
Uh,
there.
Leave it at that. So thanks a lot, Justin. There are two questions. I want to first of all start with my question, and then I'm going to go to Dr. Geston's question. You're the son of a hog farmer, and I was just wondering if you could tell me some of the one fun story of being the son of a hog farmer.
Yeah, one one story. I'm sure Mike might relate to this, but I guess often in
Are you
Nebraska
the
you'll
son of
find
a
yourself.
hog farmer too, Mike, or not? Or that was that just a dream of yours, or?
No, I'm also from Nebraska. I was the grandson of a dairy farmer,
Okay. Okay.
and my wife is the daughter of a farmer, but cattle
Oh,
as well as crops. So
okay. Sorry, Justin. I interrupted.
Oh no, yeah. No, in Nebraska, you often find yourself driving by, a cornfield or open area, and eventually through the car, even you'll get the smell of new manure wafting in. And often when that happens, my dad would like to say like, oh, that's the smell of money right there. So that's
we used to call it the bittersweet smell of country air.
yeah, okay, yeah, that's good.
Well, I really appreciate you bringing up the issue of the VA. I will point out that I don't see very many lawn signs except at election time, but I will say, and this is and I'm just wondering as another topic, uh, that one of the few lawn signs that I see today is people who are supportive of VA healthcare. So I live in a rural area, and there's got to be a way that we can capitalize on that. So I just wanted to point that out, and I really appreciate you bringing that up. So we'll start out with Foster Gestens, and I'm going to add one question to Dr. Geston's thing, and then we'll go to Dr. Lerner's question. Um, I believe that rural America, as a generalization, has been more likely to vote Republican and support MAGA policies. As important an issue as healthcare is, do you believe these policies will be enough to sway opinions among rural political leaders and voters? And again, I'll leave this for both Justin, then if Mike has a comment. And I'd like to add to that, as part of the question is, do you think we're ready? And if so, how should we frame it? Uh, to bring up the concept of Medicare for all. And I'm wondering if politically how that would sell both in a rural area and in general for the sliver that we need to swing over. Justin, and then if Mike has a comment.
Yeah, thanks for the question. No, I think that's I mean, definitely looking at the electoral map, it's you can't argue that so much of rural America overwhelmingly has voted for the Republican Party for Trump. I think I'll just sort of respond to that and nuance that in that uh, another part of that reason is that in so many rural areas, there are only Republicans who are running. There's so many races that go uncontested that often a Republican is the only choice people have on their ballot. Another thing I think, and I think we sort of saw the surface again during the government shutdown. I mean, one of the reasons for support behind uh, some of these healthcare related issues is this question of sort of rooting out fraud and abuse. That sort of generalization that's been thrown around by this administration. Um, and I think there's certainly the discontent out there among voters and people in rural areas for sure who are absolutely have been impacted and devastated by hospital closures, by lack of access, and I mean, one in four, as I said, one in four people in rural America rely on Medicaid. So these are people who really use the system, and um, so but I think connecting that to this sort of notion of fraud and abuse, people, I think in rural America, there's this value uh, of wanting. I think at its very basis, wanting the system to work, and because the system hasn't been working for them, there has been this sort of discontent and backlash to it, where um, they which has been exploited by sort of fear-based rhetoric on the right, saying immigrants, people of color, have been sort of exploiting these systems, which is false. But I think at the core of that, there is this still this understanding that people want the system to work. People understand the benefits of something like Medicaid, and they want it to work better. And so I think for Democrats, for people running against these policies, though, people aren't automatically going to be able to switch over. I think those dots need to be connected, and where that really comes to head, I think, is really taking on the power of pharmaceutical corporations, of the insurance industry. I think in a way that Bernie Sanders has, in really making the issue concrete and understandable to people's daily lives, of saying sort of it's absolutely outrageous that drug costs are soaring, and but those dots need to be connected, and that narrative needs to be made clear of that it's this sort of corporate exploitation that has been enabled by these policies that have allowed for consolidation. So yeah, that's how I'll respond to that.
In some ways,
So I would have a comment as well. I don't think policies are ever enough. I think policies and positions on issues are really important. And people care what candidates think about the issue. But I also think that we have to tell people stories about what's going on in American politics. We have to tell people stories about who we are, what our values are, why we believe what we believe. And I think when you tie policies to your values, and tie policies to stories about the fight that we're in, regular folks versus corporate CEOs, providers going up against insurance companies, or drug giants sometimes. I think we have to tell those kinds of stories, and we have to show what our values are, where our heart lays. Voting is not just an intellectual matter. It's about your emotion. It's about your sense of place in the world. So that would be my reaction to the policies question. In terms of Medicare for all, I think that right now, and in this moment in time, Medicare for all is sort of a confusing thing for people, because of Medicare Advantage, frankly. I think the politics around it has changed. Medicare Advantage is just like having an insurance company, and people are seeing the downsides of that when they get sick. And so I think it's right now that's a little bit confusing. I think what we ought to emphasize is we are for every single person having health care as a right, not a privilege. Every single person being able to afford health care. And then I think if you want to make an analogy, the way traditional Medicare has been, or say the way Medicaid is, or the way VA is, you make those analogies. But I think it's really, being specific about what you're talking about. We are for everybody having health care, period, as a right, not a privilege. And that everybody needs to be able to afford it, and then not have to fight with insurance companies when they get sick. So I think those are the stories that we need to tell about healthcare.
that's a great note. I'm going to send Dr. Lerner's question to everybody and ask them to respond, and I'll put them in the in the note that I'll send out. So that's a great note to end on. I want to really thank everybody for being on tonight. And I just want to say that for those of you who celebrate Thanksgiving or Friendsgiving or whatever, and have a great time. I'm sorry to say to both Justin and Mike, I'm a vegetarian, and so that, but have a great holiday, and we'll speak soon.
Right.